wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Thank you for joining us for today's program. I want to discuss polycystic ovarian syndrome. Polycystic ovarian syndrome derives its name from the fact that individuals, women who have this problem, their ovaries develop cysts. Now, the question is, what causes cysts? Well, the cysts can be caused by several different reasons, but they lead to a group of symptoms, and I want to share with you what the symptoms are of polyovarian disease, and then discuss the underlying causes that can lead to polycystic ovarian syndrome. First, we see with it fatigue, weight gain or difficulty losing weight, acne, oily skin, excess body hair, facial hair. Now, this is in women. Oftentimes, irregular and very heavy menstrual cycles. Sometimes they have no menstrual cycles. They're infertile, or they have trouble conceiving. They have thin scalp hair. Their hair is falling out. Mood swings, depression, anxiety, puffy skin, brain fog, joint and muscle aches and pains. These are all various symptoms that are associated with that syndrome, polycystic ovarian syndrome. And the way that it's diagnosed is first based upon symptoms, the symptoms I've just described. So we particularly look at the menstrual symptoms. Do you have irregular periods? Are your periods heavier? Do you have clotting with your periods? Or have your periods stopped? Second thing, do you have problems with excess body hair or excess acne? And do you have, if you're married, have you had problem conceiving? So if you have some of these symptoms, you'll go to your physician, and your physician will listen to you. And if you go to an OB-GYN, they're going to give you birth control pills trying to regulate your periods. Oftentimes, you go to a regular conventional doctor, and he looks at your blood tests and says, well, everything proves to be normal, because there's no specific blood test that makes the diagnosis. The diagnosis really can be made if you have these symptoms and you have an ultrasound and you have cysts on your ovaries. So what causes these symptoms? What causes the ovaries not to function properly? Well, it can be caused by insulin resistance. Well, what causes insulin resistance? A high, simple carbohydrate diet full of sugar, processed foods, all these lead to increased sugar levels. The pancreas secretes more insulin, trying to drive the sugar into the cells, and the cells become resistant, insulin resistant. This insulin resistant can have a significant adverse impact upon the ovaries. So you don't ovulate. You don't give off an egg every month. And when that happens, you're going to have a symptom that is called estrogen dominance, because your ovaries are going to continue to make estrogen hormones unless you've reached the menopause, but they're going to make estrogen hormones. But if you do not ovulate, then, and that would happen in mid-cycle normally, one day, when a woman ovulates, there's the area from which she ovulated is called the corpus luteum, which is supposed to make progesterone to balance out the estrogen, which is building up the inner lining of the womb, and the progesterone balances that and matures it, waiting for a pregnancy. But if there's no ovulation and insulin resistance decreases your ability to ovulate, it causes anovulatory cycles. Well, what would be causing the weight gain and the fatigue? Let's go back to an underlying root cause. Why did you gain weight to begin with? Why do you have difficulty with weight? Why do you have fatigue? Why is your hair falling out? Why are your hands cold? Why do you have brain fog? It all gets back to your metabolic function, your metabolic rate. And what controls that is low thyroid within your cells. Now, I have spoken to groups of women with polycystic ovarian syndrome, and all of them have the symptoms of hypothyroidism. They have those symptoms, and they have the appearance of hypothyroid. So the treatment is not birth control pills, which are counterfeit hormones. The initial treatment is if they have the symptoms of hypothyroidism, that means their metabolism is going to be slow and sluggish. You can do blood tests on thyroid, and your thyroid blood levels 90% of the time will fall in this wide range of normal, because the way the laboratories define the normal range of thyroid is they take the last 1,000 or 10,000 tests, average them. They have a mean, that's the average, and they have two standard deviations, which is a statistical term that incorporates 90% of the people that take a test. So the range of so-called normal is as tall as the Empire State Building, as wide as the Grand Canyon. And if you're out of that range, you're really a sick puppy dog. But the real question is, where's the optimal range? The optimal range is when you're in the high level. As you age, your thyroid levels are going to decline due to a change in, if you're a woman, female hormones. And males, too, is your testosterone decline. That's going to adversely affect your cell's ability to utilize thyroid hormones, which are the spark plugs of the cell. So when you don't have enough thyroid within the cells, and it's the active thyroid hormone T3, which has to be converted from T4, that means there's the molecule of thyroid with 4 iodine atoms attached to it. That has to be converted to T3 with 3 iodine atoms. That happens within the cell. An enzyme called the deiodinase enzyme deiodinates one of the iodine atoms from the thyroid hormone. That's the active hormone, T3. And you make very little of that. Only about 6% of the thyroid hormone made by your thyroid gland in the neck is T3. 94% is T4. That T4 does nothing. It's inactive. It's got to get in the cells and be converted to T3. Now, some things that adversely affect, and so what happens? If you don't properly convert T4 to T3, because in women their hormones become imbalanced, that's going to affect your body's metabolism, your metabolic rate, your cell's abilities to use and produce energy. Every cell has a power plant called the mitochondria. Mitochondria exist in your brain cells, your skin cells, every organ in your body, all your bones. Every cell in your body has a power plant called mitochondria, which produces electrical energy to drive all the biochemical reactions so your cells can function and your organs can function. So when your metabolic rate goes down, it affects every organ in your body, and it particularly in women can adversely affect the function of the ovaries. And so they won't function properly, and they'll have anovulatory cycles, they have infertility. So, and of course, if you're eating improperly and eating a high simple carbohydrate diet, you're converting that to sugar. That's raising the insulin level, giving you insulin resistance. That adversely affects the ovaries. And if you have a low metabolic rate, you're going to tend to retain that sugar and convert it. Insulin will convert it into fat, and you get, abdominal fat and increased fat deposits all over your body. So that's a reason you have a problem with weight gain. You're not getting it. You don't have a good metabolic rate because you got low thyroid within your cells. Now, when you eat, all of a sudden you start retaining this food and converting it to fat is what happens. And then you have these high levels of simple carbohydrate diets, and you get insulin resistance. And this is just a watershed event: low thyroid, weight gain, improper diet, high sugar levels, which lead to high insulin levels, which then suppress the function of the ovaries. So what do you do about it? Well, the most important thing you can do is be evaluated by a physician that looks at natural and alternative approaches to the conventional approach. You go to a conventional doctor and they check your blood and say, well, your blood looks fine. Yeah, you've got polycystic ovary disease. We're just going to put you on birth control pills. Or they may not even check an ultrasound. So they may never know you have polycystic ovary disease. They give you some cream for your face, some antibiotics or whatever to clear up the acne or the oily face, and they'll give you creams for your hair, but they won't address the underlying. Maybe they give you antidepressants, anti-anxiety medication, but they don't address the underlying problem. This is what we do at the Hotze Health and Wellness Center. If the woman has polycystic ovary disease or symptoms of low thyroid anyway, even without polycystic ovary disease, even if her thyroid level falls within a wide range of normal, we will give incrementally increasing doses of natural bioidentical thyroid hormone, not synthroid, not levothyroid, not the inactive thyroid hormone. We give desiccated thyroid hormone, which is natural thyroid hormone. It's a bioidentical to what your body makes, and we give that, and we increase the dose gradually until your metabolic rate goes up. The other thing we do in polycystic ovary disease is we give progesterone. That's what's not being made, and that's why women will get these irregular and breakthrough cycles, is because they're making too much estrogen compared to the progesterone. Although both levels fall as women march through their menstrual life, if they don't ovulate, which happens when you have polycystic ovarian syndrome, you're making no progesterone, and all you have influencing the uterus, the womb, is estrogen hormone, which promotes buildup of the tissue. So we give progesterone day 15 through 28. Those are the two primary things that we do to correct polycystic ovarian disease. Now, you can take some vitamins and minerals. Another third thing we do is we get you on a ketogenic eating program. We cut out the simple carbs, the sugars, those things that promote high sugar levels and then high insulin levels, which lead to insulin resistance, which adversely affect the ovaries. So if you're having these symptoms of hypothyroidism or polycystic ovarian disease, and you can tell that, I mean, we can do blood tests and see what a woman's testosterone level is. If they have polycystic ovarian syndrome, it's going to be elevated. And we can see that on a blood test. So there are several ways that we can make the diagnosis. Clinically, do a blood test for testosterone, a physical examination, and of course, we can check insulin levels and see what your insulin level is. And then we start you on a course, when indicated, thyroid hormones, desiccated thyroid, natural progesterone, vitamin and mineral support, a good, healthy, ketogenic, low carbohydrate eating program. Exercise helps, and plus a good night's sleep, 6, 7, 8 hours of sleep at least every night is what you need. You need to get to bed before midnight, and every hour before midnight is worth 2 hours after midnight, so they say. Anyway, this is Dr. Hotze. Hope this gives you a brief understanding of polycystic ovarian syndrome. If you want to be evaluated in an alternative setting where we take natural approaches to your health seriously, so we can get you on a path of health and wellness naturally so you have energy, vitality, and enthusiasm for life, please don't hesitate to give us a call here. I'm Dr. Hotze.
At Physicians Preference Pharmacy, we believe that prescription drugs are commonly overprescribed, treating symptoms only rather than addressing the underlying condition. These drugs offer a temporary fix, but they don't solve the root cause of the problem. Our approach is not about overloading people with medications that offer only a temporary fix. It is so important to recognize that you do not get sick because you have a low level of pharmaceutical drugs in your blood. You get sick because you are deficient in something or because your body is not in balance. As part of your healthcare team, we work with your doctor to restore that healthy balance. Sometimes this means replacing hormones, vitamins, nutrients, or even antioxidants. So how is this different than traditional treatment? Rather than covering up the symptoms with yet another medication, we work to replenish the body, restoring your health and restoring your wellness.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.